Okay, so on our cervical inflammatory process, the first thing we get to is the self-management or neutral spine. So as we're educating the patient, and this is usually going to be done first visit, we want to get across the concept that when the shoulders are forward, that throws the head forward. The head weighs as much as a bowling ball, and we all know that a bowling ball is a lot heavier out here than it is here. So ultimately, we want shoulder blades to be back, ears over the shoulders to take stress off of those soft tissues that are trying to heal. If it's a case where we have some radicular symptoms, we have to realize that when the mid-back is like this, I'm not going to go around looking down all day. My eyes are going to right themselves with the horizon, and that puts me in this position. Well, when I straighten up my back, this position is actually the equivalent of looking up all day. So we try to get across to people that when their back is in this position, it is closing down the neck, and we can show them a skeleton to see that when the neck is in that extended posture, the nerve spaces are smaller. So we can take stress off of the neck by changing mid-back position. But to change mid-back position, we have to change low back position, because we know that when you relax in the seated posture, the pelvis generally rolls back. When that happens, shoulders go forward, head goes up, everything's closed down, and no wonder when you look up like that, the joints are irritated, nerves are irritated. And even somebody that's been in a car accident, I'll tell them, your posture may not have got you in this position, but it'll definitely keep you from making a full recovery. So posture is always going to be important. We start from the ground and work up. And especially in the seated posture here, if I could have a chair over here, we want to encourage people to wedge themselves all the way back into that chair, okay? This is whether it's neck or low back, and when they do that, their pelvis is rounded forward slightly, and then they can rest in a neutral posture. Now the problem with a chair like this is just barely long enough for me, so anybody that's shorter than me is going to have problems with this, and this is where they would be encouraged to use a lumbar cushion, something of that nature. When they are sitting here, they can do some small pelvic tilts for their low back, and just something that we go over in the seated posture. Other postures you have to think about would be laying down. People have heard that a small pillow is the best, and that is certainly the case when they're laying down on their back, because you want your ears to be over the shoulders, and when you have even a contoured pillow like this, that accomplishes that goal. But the problem is, a lot of people lay down on their side, and then it's not big enough, and you can see how my head is inclined. So actually you need more of a pillow when you're on your side, and we have to be aware of that when we're positioning people here in the clinic, but also when they're at home. So this is where even doubling the pillow is necessary sometimes. I like having a hugging pillow if somebody is on their side, not on a treatment table, but at home, knees bent, but you're trying to get this neutral posture to lay down in. And just all the other common sense stuff, you got to be careful on the phone and things like that. But when I'm talking about posture to people, that tends to be what I'm referring to when we're talking about the neck. There's a kind of another spill when we're talking about the low back, and we'll get into that later.